If there is one dog that has a reputation for being a lifesaver of sorts, you could probably say it's the St. Bernard. And we are so lucky to have Arizona Humane Society President and CEO Dr. Stephen Hansen here. Thank you so much for coming by. And who is this sweet girl?
Danielle, this is Rosie. Rosie is a 3-year-old St. Bernard, as you mentioned. She was a stray.
Oh.
She was brought into our Second Chance Animal Hospital. She was very sick, and she was very thin. So we had to do surgery on her, and she's been gaining weight, and she's now ready to be adopted. She's healthy and happy and a wonderful dog.
And I saw her making the rounds in the newsroom a little earlier, so she seems to love attention. Another thing that we want to talk about that's really important here for all pet owners, really, Poison Prevention Month. And these are things pet owners should keep in mind to make sure that their pets stay healthy and safe.
Yes, it's very common for dogs to get into things. Dogs have got strong jaws. They can chew things and open them. So human medications are our single most important thing to avoid in the home. Ibuprofen is a common overdose in a dog. Childproof container does not slow them down at all. So all medications need to be stored above the counter. We also have to be very careful about food items. Raisins and grapes, very unusual. It's only the dog.
Oh, really?
It does cause kidney failure in dogs. So we do want to make sure the dogs do not consume any raisins or grapes, even small amounts. Chocolate is a common problem in dogs.
Yeah.
A dog of this size would have to consume quite a bit of chocolate, of Hershey's milk chocolate, for example, the chocolate bar that we have.
Sure.
It would take a large number of those. But baking chocolate is much more serious. It can cause seizures, vomiting, and diarrhea. So it can be a problem if it's baking chocolate.
Now, if a pet owner thinks that maybe their pet has gotten into some of this stuff, what should they do? What are kind of the first steps?
Well, what a pet owner should do is call the Animal Poison Control Center or their veterinarian.
Okay.
They should keep a close eye on their pet, looking for clinical signs. Any clues that they can give their veterinarian or the Poison Control Center is very helpful. The amount they consume and what they exactly consumed is very important.
And as for Rosie here, if someone's interested in adopting her, any special tips when dealing with a dog of this size? Because she's a unique one. She's going to probably shed a lot too, I'm guessing?
Rosie will shed a lot. She's a unique dog. She is available for adoption today at noon at our Sunny Slope location.
Great.
Important things to remember is that she can clearly open anything. She'll crush pill vials, she'll puncture antifreeze, keep everything out of her reach.
All right, keep it out of her reach, but definitely consider taking her home with you. Thank you so much for coming out and talking to us about this, and we'll let Rosie here take us to break.
Thank you, Danielle.